Hello, my name is Thomas Gray. I'm a student physical therapist here at Rocky Mountain University. I'm working under the guidance of Dr. Clausen, and I'm demonstrating electrical stimulation for muscle strengthening. My patient today is a ACL reconstruction patient who is 2 weeks post-op. She's reporting 1 out of 10 pain, and the quadriceps are not firing, which is why we're going to be targeting muscle strengthening rather than pain control. So some contraindications for why not to do electrical stimulation are 5. She's active cancer, any electrical device such as a pacemaker, pregnant, has demonstrates poor mentation and poor sensation in the area. So the settings I'm going to be doing, I'll take the camera. I'll be doing biphasic. I'm going to do the width as I'm going to increase it to about 300 just so it covers the larger muscle. I'm going to keep it at 50 for the rate, and then I'm going to be doing 10-30 just for this time's sake for today, but usually I would have it at 10 seconds on, 50 seconds off. I'm going to ask some questions to the patient. So Megan, why I'm doing electrical stimulation is we really want to fire that quadricep muscle here. So before I kind of get started, I'm going to have to put my hands on you. Is that okay?
Mm-hmm.
All right. And some questions I would need to ask are you pregnant?
No.
Are you aware of any active cancer?
No.
Do you have a pacemaker?
Nope.
No? All right. And then I'm going to do a quick screening to make sure the skin around the area is okay. All right?
Okay.
All right. Just let me know if any of this feels abnormal. How does that feel?
Fine.
Fine? All right. And then because it's a muscle contraction, I'm just going to come to the other side. And I just want you to get a good sense of what type of strength I want from that electrical stimulation, okay? So what I want you to do is I want to kind of bring the heel off the table, kind of like bring it up, but kind of push that heel into the back of your knee into that pillow. And I want you to give like 100% effort on this side, okay? So that's what 100% feels like. What we want on this side is about 50 to 60% of that, okay? All right.
Okay.
So come back over. All right. So I'm going to give the camera to my patient real quick. So usually I would use a larger pads, but they're not sticking well today. So I'm going to use the smaller squares, but usually I would use larger ones just to cover more area. Okay. Perfect. Okay. So again, we just want that 50 to 60%. Okay.
Okay.
All right. So I'm going to just start increasing the intensity, and the intensity I want is that contraction. Okay. So you're going to start to feel like a little bit of like a buzzing sensation. Let me know when you first feel that, and then let me know when you get to that contraction, okay?
Okay. A little bit of a tingle.
Okay.
I'll go up a little more. Let me know when you start to feel like a contraction, and we want it to be pretty strong.
How does that feel?
Still tingle.
Still tingle? All right. Let me know when you start to feel that muscles kind of starting to contract a little bit more. Feel anything there? Any changes?
Little bit.
We don't want it to be painful, so if we get to the point where it's too strong that it hurts.
I think right there.
Right there? All right, perfect. So I'm going to start it. So you're going to feel it for 10 seconds, and then you're going to relax for 30 seconds, okay?
Okay.
All right. I'll take the camera. So again, she's just going to have 10 seconds on, which you can kind of see the contraction here.
So like I mentioned earlier, we want to get to
And just relaxed. All right. And her intensity was 85, which is very subjective. So we usually do this for about 10, 15 minutes. But for today, we're just going to do two cycles. Okay. All right, another contraction there. And then relax there. Perfect. So I'm going to turn it off here now. Okay. So that's 2 reps there. And then when I'm taking these off, I just want to inspect the skin for any discoloration, redness, changes in sensation real quick with the patient. Does your skin feel any different afterwards? No? Okay, perfect. And so that's just demonstrating muscle strengthening with using electrical stimulation. Thank you.